Thank you for joining us today for this important conversation on caregivers and the neuromuscular community. This month, we highlight caregivers during National Caregivers Month. According to the National Alliance for Caregiving and AARP, there are 53 million Americans providing unpaid care. This number is up 6.4 million from 2015. Today, we will honor and celebrate caregivers while also answering your questions. I'm Sarah Stoney, and I'm the outpatient subspecialty social worker at the MDA Care Center at the Children's Hospital of Philadelphia. I'm honored to have been a part of this team for 6 years now, and I work not only in the neuromuscular community, but also with the multiple sclerosis team and also with the leukodystrophy team as well. At the MDA Care Center, I am able to provide ongoing support to patients and families, connect them with outside organizational resources, and also be there for coping and ongoing emotional support. I'm really looking forward to today's conversation. I'm honored to be joined by Pral Sarnsetsuri, who's mother of MDA's alumni, National Ambassador Justin Moy, and Douglas and Letitia Tatum. Douglas is a business owner and husband of Letitia. Letitia works in HR and is living with SMA. I would like to thank all three of you for being here today, and I'm so glad to have this conversation with you.
Thank you. Glad to be here.
Thank you.
While we are thrilled to be here, please know that we are offering our perspective on the role of the caregiver. We are not offering any expert opinion on what you should do. Only you and your family can decide what's right for you. We look forward to spending the next 35 minutes sharing with you our thoughts on this important topic while also answering your questions. Before we dive in, I would like to thank our Facebook Live supporters, Mitsubishi Tanabe Pharma America, Sanofi Genzyme, and Biogen for their generous support of today's program and their support of the caregiver community. Now let's jump to our first question. Okay, COVID-19 has impacted us all. How has the role of being a caregiver evolved during the pandemic? Pral, let's start with you.
With everybody home, I had to be vigilant with Justin around to be safe, and we have family members who are essential workers, so really just keeping the household safe and healthy.
Absolutely. And what about for you, Douglas?
Well, in my line of work, it's hard for me, because I have to be around people, but I try to be very social and who I am, who I'm around because of my wife. Her immune system is not strong as ours, and just keep plenty of sanitizer and alcohol in my truck and a mask.
Wonderful. And Letitia, what about you?
Douglas and I talked a lot very early on about kind of what our plans would be, just because I have the luxury of, being able to work from home kind of at the really early onset of the pandemic. But again, as Douglas stated, he has to go out and work in other people's homes. So we talked about him being very vigilant in wearing his mask and social distancing, and other important precautions to take, because of course I am in that high risk category.
Of course. And we've been getting questions from patients and families all throughout the pandemic. And really, I can't emphasize enough that ongoing communication with your healthcare providers to make sure that everyone's following proper precautions is really necessary. Okay, our next question. Pral, you are a mom and a caregiver. Douglas, you're a husband and a caregiver. How do you navigate being a caregiver and a family member at the same time? Pral, let's start with you.
I think it's having structure and good time management. So Justin and I would talk about the week ahead and what's expected for that day. So we would schedule the wake up time, the toiletry, meals, activities, bedtime, all that. Each day is so different. There would be some mornings where Justin would wake up early because I have to do something. Or there are days where meals will not be at 5 o'clock or 5:30 because he has something going on or other kids have something going on. So it's a lot of time management that takes place.
It sounds like it, absolutely. Douglas, how do you navigate this?
Well, from Monday through Friday, we just on a schedule. I have to get up, get her ready, get myself together, and the rest of the day is mine until it's time to pick her up and bring her home and do what I have to do to get her situated and let her wind down for the day. But like Charles said, it's the timing, because if you have to be somewhere at a certain time and it looks like it's going to be a beautiful day and you open the door and just start pouring down raining, that throws your whole time effect back. So it's just patience and time.
Understood. And Letitia, anything to add?
I would just echo what Prowl and Douglas said about the structure. I think it's very important for us specifically. We, similar to what Prowl mentioned, that she and Justin kind of go through their schedules. We are constantly communicating kind of what we have going on. There may be days where I have a meeting earlier at work, or I may have an off-site meeting. So we're making sure that we are constantly communicating about kind of what's on our agenda for the week or even the next day. But definitely, I think having that structure, we rely heavily on our alarms in the morning.
Understood. And, what I love about what you said, Letitia, was really about the emphasis on communicating. I truly feel as though a lot of times when I'm having conversations with family members that have that dual role of both being a family member or a partner or a parent and also assuming the role of caregiver, that dual relationship is really understood and that there's a lot of communication going on about expectations and boundaries. Okay, we'll move on to our next question. Taking care of yourself is so important. If the caregiver is not healthy or taking care of their mental health, they can struggle to take care of others. Douglas, what have you found works for when it comes to self-care and monitoring your own mental health?
Well, me, myself, I try to eat good, but I don't. So my wife pushes me to eat more vegetables, and I still don't. But other than that, it's time. It's the timing, we have to. I have more time during the day while she's at work to balance my day out, and make sure I'm exercising right because I do home improvement, so I'm always exercising and keeping my mind open for everything. And it's just like just health. You have to take care of yourself. You have to know what's right and when you need a break and when she needs a break. Basically, that's it.
Absolutely. Prowl, what about you? What works for you when it comes to self-care?
For me, it's definitely exercising, whether it's biking or yoga. My family knows it's important to me to exercise. It helps clears the mind. And again, it's just being by myself. So I took a class, right? An online dance class. And I heard Justin in the other room say, okay, nobody go into that room. Mom's doing her dance class. Don't bother her. So, by hearing that, it really touched me that he understood that it was important for me to do something by myself. And it is important to look after one another and to make time for yourself.
I love that. Good job, Justin. Absolutely. I would add to that also, too, that, sometimes addressing the topic of self-care is even difficult sometimes for some of our caregivers to talk about because they can often be hyper-focused, on the care of the person that they're looking after. And so if you have a caregiver in your life that you want to talk about how they're doing, you can even focus on simple basics. How is their sleep, their eating, their just normal healthy habits, to even start or open that conversation. It's a great place to start. Okay, our next question. What has been your biggest caregiving challenge and how did you overcome it? Prow, would you like to start?
Wow, biggest challenge. I would probably have to say when Justin turned 18. I think that's the magic number. I couldn't make any more phone calls on his behalf, like to the doctor's office, Social Security, or Mass Health, which is the state's healthcare system. So I had to teach him the administrative skills, right? Like phone calls, how to compose emails, how to follow up on telephone calls and emails, and when to call them. Also filing paperwork, completing application, reminding him to dot all of his I's and cross all of his T's, because as we all know, that when you submit paperwork and if it's not completed, it gets sent back. So I had to remind him to do all that stuff. And after a few weeks of turning 18, he's like, "Oh, Mom, now I know why you're on the phone all the time." I'm like, "Yes, because I'm on hold with these agencies." So it's really teaching them these life skills that we were never taught to do as adolescents. So that was probably the challenging part.
Prow, I think you're highlighting probably one of the most anxiety-filled transitions that my family has experienced. The reality is that the birthday of turning 17 to 18 truly is a light switch, and the reality is that that transition is not. That these are not skills that we learn overnight to learn how to advocate for yourself or even how to manage your own healthcare, let alone the management of something like a neuromuscular disease. So I can certainly see how that would be a challenging time, but it sounds like Justin really got the hang of how to become his own self-advocate pretty quick.
Yep.
Wonderful. And Douglas, what about you?
Well, my biggest caregiving challenge is trying to let people help me with her, because I just don't like nobody helping me with her, and it's just a big challenge because I feel they're not gonna do her right and handle her right and stuff like that. So, and she's always getting on me, "You need help, you need help." And the only help I think I need is my country music.
I love it. I love it. A formal recommendation from Douglas, country music. Letitia, what about you?
I think, early on, it was an adjustment for Douglas and I, when we got married, because I had been used to, my parents being my caregivers, or my siblings, or people from various agencies. Professionals would come into the home and provide care. And so there was this completely different dynamic that was occurring now, where your partner, your husband, was now my caregiver. So working through those things, those issues with communicating the needs that he needed. He got what he needed from me as well. So we've adjusted well, but I think, there definitely is that challenge there where your spouse is your caregiver, because generally, if you're family members, you don't control what family you're born into. You choose your spouse.
Yes, absolutely. And what I love that I'm hearing from both of you is that it kind of also emphasizes what we said in the very beginning, which is that this is not a one size fits all. That this process of obtaining a caregiver, who that caregiver is, what that caregiver's role is, really does change from family to family. And it's important to recognize that what works for someone else may not work for you. And that's okay, because the plan that you create with your family is really what's going to work best for you. Okay, moving on. Oftentimes, finding resources and support is a job that the caregiver takes on. Douglas, where do you go for resources and support for caring for your loved one?
MDA.
Excellent. And Proud, what about you?
I would have to agree with Douglas. Definitely MDA clinic. So we'd start with the doctors, right? And the therapists, the physical and the occupational, but also professionals at school. You have his teachers and a social worker that I would talk to. They would give me progress report and let me know and work with them how we can move forward with Justin and his needs.
Absolutely. And I would highlight both of those responses. The MDA is a great resource for looking for support. The National Resource Center has compiled a number of resources that can help caregivers, parents, teachers on their journey. Their material for teachers is really excellent on how to educate our children with neuromuscular diseases. Their goal is to help families ensure health, safety, and happiness of all of its members. They understand the importance of connecting others who are facing similar challenges. You can connect with the Resource Center by reaching out via the email address at the bottom of your screen. Also, what Prowl said about our MDA care centers, I think, is important as well. Our teams are really large and interdisciplinary, so you have a lot of different input when it comes to navigating specific challenges, whether it be a physical therapist, occupational therapist, or dietitian. Many care centers have a huge layer of support there, so both are excellent options. Okay, our next question is there a way that caregivers can get paid? So this is not an easy question to answer because it really does vary from patient to patient. This is a question I often get asked at our care center, and the reality is that there's a lot of different factors that go into this. Sometimes it's the age of the patient that we're asking about and also where they live. So for example, for our pediatric patients up until age 18, there are some programs in some states, not in the state where we're located in Pennsylvania, but in some other states where caregivers can be compensated by either the state or by Medicaid. Once you hit 18, and there are more waiver opportunities or other programs available in your state, it's much more likely that a caregiver can be compensated in some way, shape, or form. But it truly is dependent on where you live and the age of who you're looking after. Okay, our next question is for Prowl. You've gone through the transition of having a child, now having an adult in college. How did you see your role as a caregiver evolve as your child aged into adult?
Not sure if the word evolve is the word, so to speak, but Justin and I, we have good communication skills. We talk about everything, and as parents, I like to think that we give them a good foundation and that they can become resourceful and independent. So for example, when Justin went into high school, 9th grade, he did not have a cell phone. He was done early from school. So what do? Do I call mom, or do I just wait for her to come pick me up, or do I just go hang out with friends and let her figure it out? But Justin, he was responsible enough, and he called me. He went across the street to the municipal fitness center and asked to use their phone. I thought that was brilliant because I would have probably just sat around and waited until my mom got me, right? So learning to let go, learning to let them figure it out that, hey, I'm done early. What am I going to do? And that you trust in their decision making. We did eventually get him a phone like a year later, but I think that was a learning point, and I think right there was a transition into letting them go and be independent.
Excellent. And what a great example too. Letitia, as you went through that journey, what advice would you have for parents about how they can support their child through this transition? Okay. So I actually think we're having a little trouble hearing Letitia, so we're going to go back to them. We're going to go to our next question. Feeling confident in your ability to care for someone and being able to take care of their needs is important. Proud, what have been the best resources that you've used to help them through this journey and to understanding the role of the caregiver?
I think just by talking to other caregivers, that is very helpful. And also being a part of a Facebook group that I think it's called Massachusetts Transition into Adulthood. So that is one place I go to, and really talking to people that I meet at MDA events. So that has definitely been helpful, hearing their suggestions and tips on how to be a caregiver.
Oh, wonderful. And I completely agree. I think that really using the community, because I constantly say I think that our neuromuscular families are by far the experts, and that they are such an amazing source of information. It sounds like we have Douglas and Letitia back. Douglas, what have been the resources that you've used to help through this journey?
What resources have you used?
Oh, my family members, because most of them is into the nursing field, and I'm sorry, y'all. Yeah, my family members, because they're in the nursing field, and my auntie, she was lived across the street from Letitia, and I was helping her because she had MS, and
Yeah.
Oh, okay. And I'm sorry, y'all. My mom went across the street is coming back. But to let everybody know, it's something you have to love and want to do. And if you don't love it and you know you don't want to do it, please don't get into it. Because it's something you need from your heart. You know, you have to find your calling. And to me, this was my calling.
Absolutely. I by far is one of the most selfless things, I think, one of the most selfless roles you can have. I want to go back to our last question. So following up on kind of talking about those transitions, what advice, Letitia, can you give to parents who now want to support their child through the transition into adulthood?
Yes, Sarah, I would definitely, going back to what Proud discussed about her journey with her and Justin, I think it's so important to start early. So you want to loosen those reins. You know, you want to encourage your teenagers to be advocates for themselves, to be able to explain, you know, what they need, because there may, in many cases, become times where the child or the young adult is going to have to be able to communicate their needs to a caregiver outside of a family member, and to start allowing. I would also add to, you know, start trickling in and giving them more responsibility. So when that time comes where they're making those calls or to those doctor's visits, that it's not that much of a shock. I can remember, you know, my mother, when I was around 17, maybe it was even as early 16, but she, you know, if I had a doctor's appointment, you know, she would say, okay, Letitia, you call the doctor's office and you schedule the doctor's appointment. So we would have already had that discussion about, you know, what times, maybe what we were thinking about. And she would be there to kind of coach and guide me. But that was some of the earlier exercises that I remembered going through with my parents, where they started shifting that responsibility to me.
Letitia, what you and your mom did when you were a teenager is music to my ears, because I really love and appreciate kind of the whole act of really engaging and empowering our youth to become more active in their healthcare. I say often that, this is not something that is taught in school. They don't teach you about how to navigate the healthcare system, how to navigate insurances or pharmacies, or even to navigate the medical system on a whole. So these are all things that are learned. And particularly when we consider, kids that are young adolescents and even young adults, this is challenging. This is challenging stuff. So I love your suggestion of kind of starting small and even giving small little spoonfuls of responsibility as you go along through the teen years. I think that's an excellent way to try to help that exposure of what their medical care will look like when they're more independent. Thank you both. Okay, our next question is for Douglas. Caregivers can get overwhelmed navigating equipment needs for the individual living with neuromuscular disease. How did you navigate that journey of understanding the equipment needs and management of those pieces for Letitia?
Instructions, manuals, tinkering with stuff. I stole the word, but tinkering with stuff. But like 2 weeks ago, I put the wheelchair on the truck, and it just cut off on me, and I couldn't get it back on. And I'm like, man, me and my little brother sitting there trying to figure it out. Like, man, how am I getting the truck and tell Tish her wheelchair is down? She's gonna be mad at me. So I stuck it up and told her, and she's like, well, okay, it'll be all right, honey. It'll be all right. Got home, so I had to put it in manual and get it off the truck and bring it in the house, and we started fumbling with it. And I pulled these 2 little plugs out. She's like, no, honey, don't put them back. We don't know what them go to and this and that. And so I decided to go out the next day for about an hour. So she called me, honey, I figured something out. Them 2 plugs you pulled out, I think those was going to get my chair back on. So I came in and I got my earbud. And she said, stick the other end in. I stuck it in, the wheelchair came on. It was a relief.
Hallelujah.
So she called the MDA people or the wheelchair people, and they told her they had some, they look like mouses, to come over or something over there to pick them up. So, until they fix the wheelchair. But this got to go in that MacGyver closet sometime.
I definitely hear you. And, that also, I think, paints a very good theme of you always have to expect the unexpected, too, when you're a caregiver. What about you, Prowl?
Oh, same thing. You got the manual out, but I think we first start off with the MDA clinic, right? You work with the physical therapist, and then they come in with the wheelchair guy, the company, and one of the representative of the company also comes and show us, how to work the equipment. But also in our house, we have little engineers, Justin and his brother. They like to tinker as well. So I hear you, Douglas, about tinkering on the machine. So I would like to think that, if it's not broken, don't break it. Only fix what is broken, because boys, they, go a little bit further than they need to. But I think, just basically understanding the machine, read the manual, call your rep if you need to. So that's the way to go.
Absolutely. Okay, and our last question is geared towards new caregivers. So for people who are just starting out in the role of the caregiver, what advice do you have for them? Prowl, would you like to start?
Sure. I would probably say expectation, anticipation, adaptation. So expect that your day is not going to go well. We have 5 things to do in a day, but maybe 3 will work out. It doesn't fit like a puzzle. And anticipate, anticipate that doctor's appointment is going to take longer, or that, you have to go get x-rays, go get blood work, or you're going to be stuck in traffic, right? So you anticipate that, so you pack extra snacks. or you pack activities for the other siblings, whether it be reading or arts and crafts or something for them to do. And adaptation, right, ties in with the flexible expectation. So, for example, you want to leave the house at 9 a.m. Well, guess what? Mommy doesn't mean you go out of the house at 9 a.m. Mommy means we pull out of the driveway at 9 a.m., right? So at any time after 8:30, the kids, we got to get things packed up. We got to get Justin transferred. Everybody has to go to the bathroom because, last minute out the door. Winter comes around, you got to get jackets on, scarves, and things like that. So being adaptive and recognizing really your strengths and weaknesses. Just because you can't do something, it doesn't mean that you're inadequate. By recognizing those qualities is strength. Ask for help. Take the time out for self-care. Your overall mental health, your overall physical health, that's your number one goal.
Absolutely. I can't agree with you more. And I love that you ended with that, Proud, too, because, it's a exhausted cliche, but I often tell my families to think about the analogy of putting on your oxygen mask first when you're on the flight before you help anyone else. But it's so true because really, unless you are well, unless you have you're in the right physical and emotional and mind space to really be able to fulfill this role. It's really how you avoid burnout and really ensure that everyone's on the same page for sure. What about you, Douglas?
Patience. Make sure you're healthy. Take care of yourself. Make sure this is something you want to do, and get to know your client, because they can help you out more than anything in the world, because you may, like me, think I know everything and I don't. When she can tell me, well, Doug, you're putting this on wrong, try it this way, and it just fits right in. I'm like, happy wife, happy life, so I have to listen to it. So, and I'm real stubborn, but just like I said, just make sure this is something your heart want to do if you want to be a caregiver, because you can want to do it, especially if you're getting paid for it, because you're into it for the money. You're not into it because that's where your heart is at. And, just make sure it's something you love to do.
It's really beautiful. Letitia, anything to add?
Yes, Sarah, I would just kind of echo both Proud and Douglas. From the person receiving the care's perspective, two things that come to mind are communication and grace. I think it's so important to regularly communicate with each other. So as a child, when I was receiving care from my mom, or even if my siblings were helping me as they got older and we got older, I think it's important to communicate regularly, all the time. What is it that I need? What is it that you need? And with my husband, it's important to communicate, again, his needs, my needs. Proud talked about expectations. I think that's so important as well. And then extending grace. So there are going to be times where you are frustrated. You as the caregiver, are frustrated, or I'm the person receiving care. It's frustrating. Douglas is my husband, and there are times, even just as being married, you get frustrated with each other. To add another layer on that is the person that you may be frustrated with as the same person that has to help you get into bed or has to help you with, bathing or using the restroom. So I think you have to, again, extend each other's grace. It's important for individuals, especially the caregivers, to take breaks, whether that is mommy needs a break right now, so communicating. And I think it starts early on as a child, with parents communicating or the caregivers communicating that world does not revolve around you. So mommy, in order for mommy or daddy or whomever to be able to help you, sometimes that, they may need a break, and that's okay. Or even, maybe we can feel a little tension. So, honey, I'm going to go in the other room, or, Doug, you can go out for a little while. But I think that's important, and understanding that that's okay. It's not pretty all the time, but that's
absolutely. And I love how you worded that, Letitia. I love the use of the word grace, because I think it really does pay homage to kind of the importance of this role, and how important it is in the relationship of the caregiver and the person that they're assisting. In addition, I echo everything that you all have said, and truly, to reiterate that this does look different for every single family, and it's about trying out what works for you, and getting that advice and information from other neuromuscular families is absolutely a fantastic place to start. All right, so I think that's all the time we have for today. Thank you everyone for attending today's Facebook Live event. If you were unable to join the full conversation, the recording will be posted on Facebook as well as mda.org/COVID-19. I would like to thank again Mitsubishi Tanabe Pharma of America, Sanofi Genzyme, and Biogen for their support of this Facebook Live program. Proud, Douglas, and Letitia, thank you so much for joining us today and for sharing your thoughts and experiences, and for all you do to support your loved ones and caregivers in general.
Thank you.
Thank you, Sarah.
Thank you.
You're so welcome. Stay up to date with future Facebook Live events by liking MDA's Facebook page. MDA looks forward to continuing these important conversations with you. The next Facebook Live event will be December 1st, and will focus on a look back at the year in research. Take care. Thank you again for joining us today on behalf of myself, Proud, Douglas, and Letitia, and the MDA. I wish you all well, and we would like to thank all the caregivers out there for all that you are doing every day to support your loved ones and the community.